we heard Senate Bill 453 the other day, and we asked the parties to all go back and work on compromising language. So who's going to present that to us?
I'm not.
No one's going to jump up. Scott, are you doing it? I'll just call you out because I saw you first.
Madam Chair, you had to look right past the other Scott to see me, but I appreciate being called on.
I didn't say that I bent around and did a scope of the.
It's fine. Scott Bruner, I'm the Deputy Secretary at KDADS for Hospitals and Facilities. Thanks for continuing consideration of the bill. We did work with the stakeholders, many that you heard from during the bill, during the public hearing on the bill, and did come up with some compromise language, which I don't know if you have in front of you or not, but the primary things we discussed as a group and are trying to change in the bill that you saw. Number one, the bill replaced the words unlicensed employee with certified aide in several places through the bill. The group thought that was confusing. The stakeholders group thought that was confusing because it kind of blurred the lines between certified aide or somebody who's a student. In the original statutory language, using unlicensed employee meant somebody who's in that training, in the training process, in their having received their first 40 hours of training so they could work in the facility, but haven't completed the CNA training. And that unlicensed employee is also used in the Nurse Practice Act as a way to designate who can be or who's under the supervision of a nurse or others. So we're recommending that we change back to unlicensed employee. You'll see in the bill or in the balloon that that Revisor Abbott put together and helped us with. We did leave certified nurse aide in some places in that replacement just because it's the more appropriate reference, but we think we got all those laid out the way that would make more sense. The second change on page 2, one of the issues that the group wanted to clarify was what it meant, what supervision meant. So a registered nurse has to supervise the anybody who's doing training on their behalf or other instructors. As we talked about it with in the group, we wanted to adopt the definition of supervision that's in the Kansas Nurse Practice Act. We thought that was the common definition that would be most acceptable, so we've made that change. And you'll see that in it's about line 14, and the bullet talks about remaining, so 40 hours of training and remaining hours in the certified nurse aide training shall be performed under the general supervision of a course supervisor. We define course supervisor in regulation, which is what the next sentence says, and then we define supervision under KSA 65-1165, which is the Nurse Practice Act. Then the other significant change is what it means to be in good standing. So an instructor has to be in good standing. We had a robust discussion about what that should mean. And what we tried to do was adopt the definition of in good standing that's in House Bill 2477. And that's what's in the balloon that's labeled with a B. And you may hear some additional discussion from other stakeholders about this is the definition of in good standing that's in the KDAD section of House Bill 2477. There's also a definition of in good standing that applies to other licensed healthcare providers regulated by the Board of Nursing and the Board of Healing Arts that has a couple of other provisions in it that may be, we talked about both. The group settled on what was in the bill, and we did talk about what was in the Nurse Practice Act, but the object was to use a definition of in good standing that you've already passed in statute that we could use, and so that was the intent. There are some other kind of cleanup language we thought to again identify the certified nurse aide course and identify that specifically, but other than that, I think that got us to a place where the stakeholders were mostly aligned with the direction of the bill and giving the agency some authority to move this through the regulatory process so we could also make some updates to the CNA training curriculum so it'd fit with the objective of the group. Probably should have started with this. Everybody agreed that we wanted licensed practical nurses to be able to be instructors in the CNA training course and expand the pool of people who could do that training. Just want to make sure there are adequate controls around supervision, in good standing, who was licensed, those kinds of things. So I think we got to a reasonably good place in that process. I'm happy to stand for questions about the amendment or the process we went through if the committee has them.
Okay, and I might mention, committee, before we go to questions, I kind of added to your amendment that you had given, so you weren't a part of this. With a lot of the discussion that we've been having is that we would require the Board of Nursing to report to certain legislative committees, which would be the House Health and the Senate Health Committee, on the number and nature of complaints received in any given year. So, all right, committee questions, Representative Epley, and then Representative Barker.
Thank you very much, Madam Chair. And I'm just curious, I've just scanned this for the first time. I hadn't seen it till just now. And is there a section in here about hospitals doing training or not? Did I miss that?
We did not include that in our discussion with the stakeholders. The hospitals were represented, and we have talked about that. The hospitals have brought that to the agency's awareness earlier in the session. We did ask, so CMS and the federal government defines where training can happen. We did ask them an initial question about how hospitals could be a training site, and they told us they couldn't be. We know some other states use hospitals as training sites. We just need to figure out the process of doing that. So we didn't include it in the amendment here because I think we have some due diligence work to do on the agency side before we were comfortable adding it to the statute.
So it's not no, you just think it needs more time to get vetted out? Is that basically it, if we would ever use hospitals as training sites?
I think we need more time as the agency to figure out how to do that. Because our initial response from our regional office colleagues with CMS were that you can't have a hospital do CNA training. But we do know that Missouri does it, so there is a path. We just don't know what the path is yet.
There's intermediate organizations with hospitals, Scott, that can allow training that are not directly part of the hospital, but they're associated with the hospital that I know can do training in other states. I'm a little, I guess, frustrated that we can't figure that out, but maybe it's just going to take more time. I don't know.
We have some more work to do on I would characterize it as due diligence. I don't want to give you a bad solution that I can't implement.
Okay.
I think
I don't want to violate CMS rules and regs. I get that, but okay, thank you. Thank you, Madam Chair.
All right. Committee, Representative Barker.
Thank you. Scott, when you said this is a compromise that you've worked out, who did you work it out with? I mean, all the proponents, are they all comfortable with this?
The proponents and the opponents.
all the proponents, I don't, the Board of Nursing shared comments with us. They weren't able to participate in the meeting that we had on Friday afternoon late. They did have a representative or somebody that represented the board's opinion, but we had the proponents, the opponents that you heard from, the Board of Nursing, Hospital Association. I don't think we missed anyone, but I may have missed somebody I don't think I missed anybody who testified or provided testimony.
And they're all in agreement with this amendment?
On the general contours that I talked about, yes, a particular, and I've shared various drafts of the amendment language with them and haven't. I will say the one thing that the Board of Nursing did raise was that definition of in good standing that they came away from the discussion that we would use the Board of Nursing's definition of in good standing instead of the one that's applied to KDAD's. So that may be one area where there's not.
And I believe there'll probably be an amendment to that to clarify that. But to get back to
What amendment?
I was just someone handed me a document. I think one of our members will be offering an amendment to clarify that language on good standing, and we'll wait for that debate. I did talk to you prior to I'm going to have an amendment two amendments. The first amendment is to allow hospitals to train CNAs. I know they do it in Missouri. I know they do it in several other states, and sometimes you have to ask CMS permission. And I understand that, but if we get it in the bill, then you would be obligated to ask them to go forward. So sometimes, to sit back and wait for them to come to us, probably never going to happen. And we'll address that when we're working the bill, Madam. And the other one is you changed the names back to unlicensed employee. That's because it's CMS language?
No, we thought it was clear to identify students that were in that 40-hour training component versus somebody who's completed their CNA course. It didn't, so we wanted to be clear that we weren't creating a new category of employee or a new category of trainee. It's an existing, something in the existing statute and regulation.
You know, I thought, well, okay, maybe trainee or something like that, but unlicensed employee, I don't have a problem with that. The Senate's the one that changed it, and that doesn't bother me. We change anything back from the Senate. But I did mention to you, and I think you're on board, that I would have an amendment to change it from the 40 hours is good, but they must work forward to get the additional 50 hours and then become a CNA. And I think my amendment has a period of time in it that says, you know, we're going to hire you, we're going to train you, but your goal is to become a CNA and hopefully an LPN at some place and maybe an RN. And a lot of the RNs have started out as CNAs. So I just think we need to encourage them to go forward. And we'll do that when we work the bill. But my understanding from talking to you, you have no opposition to that.
That's in regulation today. It'd be the legislature's decision if you want to add that to the statute or not. That would reinforce what's already in the regulation because that's the federal requirement.
All right. Thank you, Madam Chair.
Okay, I just wish, Representative, you had shared that with us so that we could kind of have that discussion together. Because that's why I said I don't like, you know, as I started my, the session out is I try not to do surprise amendments on folks. So.
I appreciate that, and I mentioned it to you when we heard this bill that I would have some amendments, and then I talked to Scott and had him draft them. I didn't think it was a surprise that I would be bringing those. Anybody that's asked, you had told me to go out and talk to the KDADs and stuff and get them on board, and that's exactly what I did.
Okay, well, no, and it's not like you can't do it. I'm not saying you cannot do it. I just kind of expected that it'd all come in one amendment, but that's fine.
Okay.
All right, Representative Reese.
When I conferred with you and you said go out and talk to the proponents and the opponents, and which I've done.
Okay, okay, we're moving on. Representative Reese.
Thank you, Madam Chair. Yeah, the thing within good standing is the piece that was left out of the old HB 2477 is that pending and existing disciplinary actions, that wording is left out of the new explanation for in good standing, and I think that language really needs to be in there. And it could probably just be incorporated into what's here now.
Where are you referring to, Representative?
Let me see, where is it? Page 2B, balloon.
Okay, so what is it you're talking about changing in there?
It's more like adding, includes the national license, we need to include the language, includes pending and existing disciplinary actions. Try to see where it'll go. Disciplinary conditions. I wonder if it could go in between where it says limitations or restrictions, comma, including pending and existing disciplinary actions.
You understand what she's talking about, Scott?
Mm-hmm. Yes,
That one.
Madam Chair.
That's Scott. Do you have an opinion on that?
I don't have a problem with the language. I'm trying to figure out where it goes in the sentence structure too.
And that's this Scott's
But I don't want to step
job
into the other
figure
Scott's
that out.
role.
Yes. I will take that burden off of you.
Thank you. I can downshift to English major pretty quickly, but that one I have to think about a little bit to where
It
would
wouldn't
fit.
help because it's legalese. It doesn't even.
That's true too.
It's not even in my world, so. Revisor Abbott, when you're ready.
Thank you, Madam Chair. I think Representative Ruiz was close. I think it would be more appropriate at the end of that sentence. So in good standing includes possession of a license, et cetera, subject to probation or non-disciplinary conditions, limitations, or restrictions, but does not include a license, certificate, or registration that is revoked, canceled, or surrendered. And I would add, or subject to pending license-related disciplinary action. Because if I'm understanding the intent correctly, it's that in good standing excludes somebody subject to pending action.
Yes.
So I think at the end of that sentence would be appropriate.
Okay. Thank you. Thank you, Madam Chair.
Further comments, questions on the amendment before us? Representative Epley?
Thank you, Madam Chair. I would like to move that we pass on the amendment out and apply it to Senate Bill 453 as presented here today. These, there are multiple
Balloons.
pages, balloons here. It's a big bouquet of balloons on pages 1, 2, 3, and 4. 4,
Including the language that,
including the additional language that we just
Representative Reese
got
just-
from Representative Reese.
right. There a second? Oh.
I didn't see it.
Thank you, Madam Chair. Just
Okay,
for,
can we just get our second?
I'll
then we can
second, yes,
Okay,
Madam Chair.
seconded by Representative Clifford. Now we can visit.
yes, just for clarity on page 3, Representative Ruiz's language would be added to the in good standing balloon there as well, in both places.
Good question. Yes.
Okay, thank you, Madam Chair.
Yeah, sometimes just to give you kind of an idea, we'll go ahead and make sure that we're on the amendment or whatever, and then we go into discussion. So that's why we were hesitant. Make sure we got a second. So thank you. That was a good catch. Are there other questions or comments? All right, seeing none, all in favor signify by saying aye.
Aye.
Those no, ayes appear to have it, ayes do have it, motion carries. We're back on the bill. Representative Barker.
Thank you, Madam Chair. I have an amendment, Scott. Just tell me which one you're bringing out first. Yeah, that'd be fine. May I explain, Madam Chair, while they're handing it out? This is what I would call a simple amendment. This just allows hospitals to also train CNAs. I mean, if we have a shortage of them, we just need to expand the number of folks who can do that, and hospitals have RNs and LPNs on their staff. And I know in my area, I have a hospital that also owns a nursing home, and they've requested this over a number of years. I've talked with the Hospital Association. They're very supportive of this. So it's just adding one additional entity who can train CNAs. I'll answer any questions.
Is there a second? Seconded by Representative Wolf Moore. Questions? Representative Epley.
Thank you, Representative Barker, and I appreciate the intention of your, of this. I just am curious, you've got a nice list here of other sites where training can occur. What about assisted living environments? Because they do all-inclusive elderly care also. Would that be in all-inclusive care for the elderly, or should we insert assisted living environments? Or is that not part of what they should be doing as a site to train CNAs?
My response to that is, one, I like the imagination that you do. I didn't think of it, but also when we start going outside, you know, I know all the hospital people are trained. I know they have the staff of RNs. They have a staff of LPNs. I just felt more comfortable without having a hearing on additional places that could train them, because I don't know what the quality control would be. And I have great faith in the hospitals being able to take this job on and do it properly.
I appreciate the spirit of your amendment, and I just wanted to bring that up and didn't know if you wanted to include that or not, but it sounds like you're good with what you have right here, so.
I am good with what I've got.
Representative Barker, you said to train CNAs.
Well, my understanding is the 40 hours that these unlicensed or unidentified or whatever we want to call them now, workers would be working towards their CNA. So if they train the unlicensed people with a goal of them becoming CNAs, or the hospital could just have courses on not being an unskilled whatever licensed person, just go ahead and, if we get more CNAs, we don't need these 40-hour people. But if we do have the 40-hour people, they should be working towards the goal of becoming a CNA.
So you want them to be training these unlicensed individuals, not just in nursing homes, but in hospitals?
That is correct.
And hospice.
And hospice.
Okay. Representative Kelly.
Thank you, Madam Chair. I just wanted to follow up on Representative Epley's comment. I think that assisted living should be in here. I mean, a number of nursing homes, long-term care facilities have multiple complexes. Some don't, but they have the same problems with CNAs and others, and I think they have the capability to do it, and I think it should be in there because as people like me advance in age, that may be our next stop, and I would like to, have that included in there.
Representative Kelly, being a former banker, I doubt if you'll be on the Riviera somewhere spending your final years. But I have no objections. I didn't know how the committee would feel about that, but I would always be open to a substitute motion to add that.
Madam Chair, I will make a substitute motion then, because I didn't want to, poor Representative Barker worked so hard on this amendment, I didn't want to squelch it, but I just would like to see us add assisted living in the list of facilities that can offer this on the balloons as presented and listed here. So it'd be hospital, hospice, and then comma, assisted living, or program for the all-inclusive care for the elderly. And that would be in, what?
They're a part of adult care homes. They already are included in that.
Revisor Abbott, go ahead and explain why this may not be necessary.
You're talking about assisted living, right?
Yeah,
They're not nursing homes.
Yeah.
but they're defined in, no.
Thank you, Madam Chair. So the statute as it exists refers to adult care homes everywhere. And in other statute, KSA 39923, adult care home includes a whole list of things, including assisted living facility.
So my understanding is I was perfect the first time.
We're not going to do that, or we could do what Representative Kelly just said, but I won't repeat it. Okay, further discussion on the Barker Amendment. Representative Arnberger.
Thank you. My question is for the revisor, just so I completely understand. Programs of all-inclusive care for elderly, that is essentially nursing home and assisted living, right? Is that just the broad term of it?
Yeah, Madam Chair and Representative, Program for All-Inclusive Care of the Elderly is usually called the PACE program.
Okay.
The assisted living and those other types of facilities already fall under the category of adult care homes, kind of more broadly as that term is defined.
Okay. I was just trying to understand. Thank you.
Okay. Further questions? All right, seeing none, Representative Barker, you may close.
I move my amendment.
All right, you've all heard the motion by Representative Barker to amend Senate Bill 453. All those in favor signify by saying aye.
Aye.
Opposed, no. Ayes appear to have it, ayes do have it, motion passes. Back on the bill, Representative Barker.
Thank you. Scott, if you would hand out my second amendment. And this basically, what I talked about earlier, these unlicensed individuals that have 40 hours, I want them to continue. I think continuing education or more education is always better. I thought about putting something in it about 6 hours working with Alzheimer's patients, because that's a unique patient, if you ever had those, unfortunately have those in your family, someone's diagnosed with that. But what this does is you can start out with 40 hours and go to work. But within a period of time, I think it's 4 months, correct, Scott? Yes. 4 months, you must be working towards becoming CNA. So you have a goal in front of you. So with that, it's pretty simple. With that, I'd stand for questions.
Is there a second on the Barker amendment? Second by Representative Blex. So we're back on the amendment. I guess our only question is that you're wanting to put this 4 months in statute instead of it just being in rules and regs, because currently it's already covered in rules and regs. They have to do that within 4 months.
I know, and as many bills that we've had about rules and regs not following what the legislative intent of the bills were, I just want to put it in statute so that there's no, if we have another crisis, they can't vary from it. They have to follow the statute. So you're correct. I am putting it in statute, or requesting to put it in statute.
Well, I've got the reviser looking up something. Questions? Representative Reese.
I'm wondering about the cost of this. How, I mean, it feels like, I guess, okay, so in the rules and regs, it sounds like there's 40 hours already, the 40 hours, and then you have to, you have 4 months to get the extra 50. That's correct. I think that's correct.
Representative Barker?
I would have to go back to KDADS on that. I don't know if they have a 4-month period of time or not to get the
Okay,
additional.
Scott Bruner from KDADS is shaking his head. If you want to come up and speak on it, Scott, that's fine.
Scott Bruner with KDAD. That's correct. The federal regulation says you've got 4 months to complete the remaining. It's 75 hours in the federal reg, but it's 90 in Kansas. So that's correct.
Right.
The 4 hours or 4 months is in regulation.
It's federal regulation.
And state
not
regulation.
in our state.
It's in
as
state
well.
regulation as
So
well.
federal and state.
Yeah, the federal have 76 hours, I believe, Scott. Correct?
75.
And Kansas requires 90 or 96? 90? And I just want to make sure that these folks get additional training and give them a period of time so they can have a goal to work towards.
Did you have something to add? No, not you. You got to turn around. Just state who you are and who you're with.
Lacey Hunter, I'm the Commissioner of Survey Certification and Credentialing for KDADS. I just wanted to let the committee know that the difference between the 40 hours mentioned in here is that it is 40 hours after, or 4 months after they've completed their 40 hours. The federal regulation states that an adult care home can hire an individual for up to 4 months before they must have completed 40 hours of training to continue as an employee. So those 40 hours are found in 2 different parts of the CNA program.
All right. Thank you very much.
Thank you.
Further comments, questions on the Second Amendment? Representative Lynn.
Thank you, Madam Chair. I'm wondering how then this would be different as far as calling them an unlicensed employee rather than like a certified nurse aide trainee or level 1 or level 2, which I believe is how they're distinguished when they haven't completely completed their training. So I guess I'm wondering if it's the same. Instead of calling it an unlicensed employee, I believe they're called certified nurse aide level 1, I think, when they're doing their first 40 hours.
That is correct.
That is correct.
So I'm wondering if we are confusing it by continuing to call them unlicensed employees.
Yeah, I think that if I recall correctly, though, the unlicensed person is what the proponents and opponents had come back to agree on. Scott, would that be right, that in the discussions with opponents and proponents that you guys came back to the unlicensed language? Is that correct?
Scott Bruner with KDAD. That's correct.
Right. So that's where
how
that
it's-
came from.
That's the way it's referred to in the Nurse Practice Act as well.
Okay.
As unlicensed employee.
Okay, thank you. Thank you, Madam Chair.
I always like to go back and rely on the experts. We're just the vehicle to move it forward, so. Are there further comments or questions on the second Barker amendment? All right, you may close, Representative Barker.
I close on my amendment. Thank you, Madam Chair.
Okay. You've heard the Barker amendment. All those in favor signify by saying aye.
Aye.
Opposed, no. Ayes appear to have it. Ayes do have it. Motion carries. I believe you have one more or two more. That's it? Okay. I believe that was Blex did.
Representative Blex did.
Give me,
Did you second?
yeah. Let me just get my notes here. Okay, we're back on the bill. Is there further discussion, further amendments? All right, seeing none, Representative Eppley.
Thank you, Madam Chair. It kind of feels like we just about rewrote this in committee, but with a lot of help, we got it done. So having said that, I'm going to say that, ask that we move Senate Bill number 453 as amended significantly out of committee. Thank you.
Is there a second? Representative Ellis. You've heard the motion to pass out Senate Bill 453 favorably as amended by Representative Eppley, seconded by Representative Ellis. All those in favor signify by saying aye.
Aye.
Opposed, no. The ayes appear to have it. Ayes do have it. Motion carries. Okay, committee, that is it as far as us working any more bills this year. So that was the last one that we had to put out. We are adjourned until whenever.
Further notice.